Well, the diagnosis and removal of bulging veins and spider veins used to be a very painful experience, but not anymore. We recently stopped by the Vein Center to learn more.
So many things have been tried for varicose veins over the years, and we've seen so many things really not pan out. And the old procedures, the vein stripping and so on, were so difficult to go through and to recover from that we'd kind of gotten soured on all that. When this came about, it was a coming together of several new technologies, most of which were driven by cardiologists working inside coronary arteries. So all the equipment got smaller, and someone got the idea you could work inside the saphenous vein and close it with a laser, which allows the procedure then to be done through a needle site under local. It all sounded too good to be true.
But it wasn't too good to be true. The new procedure used by the board certified doctors at the Vein Center is far less painful and requires less downtime than the old vein stripping procedure.
It can take many years for it to really get full blown. And many women might have started to get symptoms after they had children. 20 years later, we see them when it's really blossomed. And the problem is that during pregnancy and even jobs where men, for example, stand a lot, the valves in the superficial veins become incompetent. That is, they no longer close properly. From then on, every time your legs are below your heart, the blood's going the wrong way down through that system. Well, over the years, that vein dilates, more valves give way, and the whole system becomes very stretched. At the end of a long day of standing, the veins are very inflamed, and that's the sensation that people describe as heavy or aching or itching, all those types of things. We're talking about getting good long-term results, closing all the veins that are causing the problem, having minimal chance of the problem coming back, and things like that that have evolved as we've gained experience with now over 8,000 of these procedures. We're asked if we still have to do open stripping type procedures anymore. I haven't had to resort to that in probably 7 or 8 years, because over many years I'd become so disenchanted with how difficult a procedure it was and how different than this that I told most patients that probably the treatment was worse than the problem. Now, with the modern things that we have, it's just the opposite.
And the doctors wanted to make this process even easier for their patients' pockets.
So over this 10 years, we've developed a relationship with the major insurers in this area. They know our product, the kinds of cases that we propose. We have excellent rates of success of getting procedures approved. So in most cases, it's considered as a mainline medical treatment, just as if they had their gallbladder removed or something like that.
And at the Vein Center, they do a thorough check to make sure you're a good candidate for the procedure.
If we do an ultrasound and it's not in the veins, we can help steer them toward an avenue that might give them some relief. We see a lot of patients for leg swelling that may or may not be due to vein problems. And that's what we're here for, is to basically serve them and the people in Nashville. It's not just to generate vein procedures.
The Vein Center has locations in Belle Meade, Cool Springs, and in Mt Juliet. To say goodbye to varicose veins, give them a call at 615-269-9007 or log on to veinreliever.com.